There are ways that this can be addressed during the IVF by maybe if you pick up at the beginning that the hormones are going too quickly, you can reduce the dose. You can start a suppression drug earlier if your patient's not already on a suppression drug, or you can change the type of medication, and sometimes that can have an impact. Not all the time. So sometimes, no matter what you do, there's still going to be some follicles which won't grow. I think that's inevitable, actually. But there can be things done to try and give the optimum outcome possible for this patient. And that's definitely one reason why we like to monitor very closely the IVF cycles with blood tests every other day and a scan every other day so that we can see what's happening and if we need to tweak and adjust the medication to try and stabilize and control. If it's going too fast, we can tone down the drugs. If it's going too slowly, we can push them up a little bit. If the hormones are not quite in the right range, we can change the medication. And all of this can hopefully give the best outcome possible. But with assistance with conception, it's not quite as high tech as IVF. So the drugs that we use are usually tablets that we give, usually letrozole or tamoxifen, or some people use Clomid as well, which is something similar. And we don't really have so much control of this. But also the aim is different. So with assisted conception, we don't aim to get many follicles, many eggs like with IVF. We don't want that actually. What we're aiming for is one or two, or maybe if it's a slightly older lady, we might go for three follicles. But definitely, if we get more than that, that's not a good thing because we want to reduce the risk of multiple pregnancy as much as possible. So there wouldn't be any medication before the stimulation starts. The stimulation is only a short course of for 5 days, and then we check and see what's happened. But no, to answer the question, there's no treatment given before the assisted conception because it's a more simplified treatment compared to the IVF. With IVF, there's a lot more you can do.